Anyway, some of the UK's top scientific advisors have come to blows, with Professor John Edmonds claiming that the UK government did not act quickly enough on coronavirus lockdowns. Well, we did here. However, the chief scientific advisor, Sir Patrick Vallance, he's the bloke who was running around saying we've got to have herd immunity, let everyone die and then we'll sort it out. He insists that the UK did act quickly enough. Well, writer, broadcaster and journalist James Delingpole, also a great mate of Boris Johnson's, joins me now from London. How are you, James?
Good day, Rowan. I'm very well, thank you.
Excellent. Good to see you. You're looking good there. How's lockdown in whichever part of the beautiful UK you are in?
Well, mate, I'm going through hell because I'm surrounded by 2,500 acres of rolling countryside. I live on somebody's estate. I rent a house, and it's just fantastic. There's nobody around, and I'm free.
Fantastic. Well, you don't let the New South Wales or the Victorian police know that, James, because they'll be straight on to you, because they don't like anyone wandering through the woods or wandering down to the beach. That's how
We've got the same problem.
Well, tell us about it. You got there ahead of us, so tell us about it.
So for example, my local head of police had to be reprimanded yesterday by the Home Secretary, because he'd put out this menacing message saying that if people didn't start mending their behaviour soon, he would send in his police to investigate the contents of their shopping trolleys to see whether they had any non-essential items.
Oh,
now, it sounds like a sort of fascist state. We call them
Nazis. All these policemen who are overreacting and considering it their job now to harass ordinary people as they go to the supermarket, which is outrageous. I mean, whatever happened to the notion of policing with consent?
Yeah, well, we've seen a lot of that here, James. As I said, we've had surfers rounded up, people sitting on a beach. Famous shots went around the world of a police car driving across the park, and some poor bloke who was sitting there having a kebab or something, he got rounded up. So talk about the police state. But there's a huge difference, James, between only a few weeks ago we were saying, well, Australia's following the same curve, the same path as the UK. And in fact, that was one of the reasons myself and others were saying, come on, we've got to act quickly. Let's act quickly to avoid what is happening in Italy and the UK. And touch wood, it appears, James, as if we might have, or hopefully at this stage we've sort of pushed the curve down. So what are the lessons from Britain, or what are the lessons for Britain from Australia, do you think? How bad is it in Britain? We hear terrible things. How bad is it?
I'm wondering, Rowan. I'm wondering, am I the first person to wonder whether this is the new millennium bug? I mean, I'm perfectly aware that there have been parts of the world where you get clusters of outbreak, where it's much, much worse than anywhere else. So, for example, northern Italy was clearly an outlier. It was anomalous in as much as it had the biggest population of Chinese people in Europe. I think 50,000 people work in the Italian rag trade in northern Italy. So you can see why the Italians had problems. France and Spain, clearly, they've had trouble too. But so far in the UK, we have not fulfilled the promises of the Doomsday pandemic models that were given to us by the supposed experts. And I'm hearing stories, they're keeping this quite quiet, but I'm hearing stories coming out of hospitals which are being completely underused and doctors and nurses kicking their heels. I know that there are parts of London, for example, where they're close to being overwhelmed, but it seems to be a bit of a mixed picture. It's not the doomsday that we were promised, and I'm wondering whether it was really necessary. And I know you were asking the same question. I think we're going to ask ourselves, was it really necessary to tank the world economy and cause many, many thousands of deaths from other causes in order to stop this disease, which doesn't seem to be as big a problem as the so-called experts promised us?
Well, it was a problem for Boris Johnson, so great news. He is now out of intensive care. James, he's a mate of yours. You both worked at The Spectator there. What lies ahead for Boris? And Far away.
I've known Boris since university, and I must say the most frightening moment in this crisis for me was when the news came that Boris was in intensive care. I mean, he's slightly overweight, and I think that doesn't help when you get coronavirus. He's also a sort of A-type. He works far too hard. So when he was admitted to intensive care, I thought, blimey, this really is serious. And I think a lot of the country felt the same way. He's a very much loved, popular figure because he's very jolly, and he's the kind of person you want leading your country in a crisis. And when you looked at the stats for people admitted to intensive care, the outcomes aren't that good. If you get to that stage, it's a sort of 50-50 chance. Now, after 3 nights in intensive care, and he didn't get pneumonia, we've been reassured, which is obviously a good thing because that could cause long-term damage. Boris is back in an ordinary unit. I do nevertheless wonder, Rowan, actually, whether this could have been averted if Boris had been treated with hydroxychloroquine. Chloroquine,
yes.
the malarial.
Tell us your thoughts on that, James.
Well, it's interesting. I'm pleased to say that, in all modesty, I was one of the first journalists to break the story about chloroquine being a potential game changer. And when President Trump adopted it, it became a political debate, not a medical debate, because basically the half of the world that hates Trump started campaigning against hydroxychloroquine, saying it hasn't been tested, it's designed for malaria, not for COVID-19, it hasn't been tested in randomized clinical trials, etc., etc. Well, if you go to a doctor in America, for example, private doctor, your protocol will include hydroxychloroquine. It's the same in Brazil, it's the same in lots of countries, not in the UK. Extraordinarily, our chief medical officer has decreed that only tried and tested medicines can be used, which basically consists of oxygen and paracetamol. And that's it. They're just testing chloroquine now, but they're not using it routinely. I reckon people have died because of this kind of bureaucratic, sclerotic, more than my job's worth public health bureaucracy attitude.
Unbelievable. James Delingpole, always so great to chat to you. It's Good Friday here. I guess it's Good Friday morning where you are. Have a great Easter, and I urge people to go to the Delingpod to look up James Delingpole's podcast for lots more on climate change, on the hydroxychloroquine and Trump and much, much more. Thanks so much, James.